And speaking of coronavirus, we have some new numbers for you this morning, both good and bad.
Some good ones. So the good ones, at least, let's start with that one. Let's put that up there on the screen, which is that we had 1.1 million shots, highest single day total in nearly 2 months. That's from the White House. Now, a lot of that is frankly just driven by what happened with the Delta variant. And we have seen a huge spike in cases, the most that we've seen almost since January. And the number of deaths also creeping back up over the $1,000 a day. Or 1,000 deaths a day mark, unfortunately. But what that really does show us is that the profile of the unvaccinated and more is also beginning to shift. So let's put this up there from the New York Times, which actually did a pretty good investigation. One of the things that we told you repeatedly is that Black Americans were most likely to be unvaccinated per capita. That's actually changed quite a bit. And really, Krystal, that confirms some of the data that we dug into from the Kaiser Family Foundation, which is that what the Kaiser Family Foundation showed us was that Black Americans at the time, and this is when Delta was less prevalent, were in the much more likely to be in the wait and see approach. And we're saying, hey, look, if I think I'm at risk, then I'm gonna do something about it. Given Delta, it seems that a lot of people have done something about it. Really, the group that remains now, it's largely white Americans, many of them older, a lot of them Republicans. But really what we're trying to do here is just show the data, and we want to do what the media is refusing to do. I don't want to shame anybody here. It's not about shame. It's about pointing out the facts and then maybe talking about different strategies and more that might convince people to get vaccinated. My own particular case turned into some culture war thing. I saw some people arguing about it online.
You have to stop reading shit online.
I know, I really do.
You gotta stop reading.
I had nothing else to do. I was trapped in my house. Okay, so people were like, but Saagar, you got COVID, even though you were vaccinated. Now, actually, there's a lot of new studies, especially given out of the UK and more, where if you have a breakthrough case of COVID and you're vaccinated, you have something like super immunity. So that's great for me.
Congratulations.
But really what it is that my particular case, people are saying, well, if you can still get COVID after you're vaccinated, then what's the point? Well, the point is that if you look at the ICU and death number, that the vast majority of the people in the ICUs and who are dying are people who are unvaccinated, especially those with comorbidities and those who are ill in the elderly population. And here's the other thing. Just because I got a breakthrough case of COVID, just because I got COVID while I was unvaccinated, in the aggregate, population-wide, you are still less likely to get COVID whenever you're vaccinated than if you're not. Now, it may not be, 40% or whatever that they're saying, but something I've tried to emphasize on the show so many times is that in the aggregate, little bits of percent matter. We are a country of 330 million people. If it decreases the chance of overall population-wide spread by 10%, guys, that's millions of people. And then each individual person who is infected then becomes a vector for infection for others. So you have to think in a very, very holistic way. If you're young, I understand. Saagar, you're a young guy, you're 29, you're healthy, you got COVID. Yeah, it still didn't feel good. I'm not gonna lie to you. I'm gonna tell you exactly the truth, which is, yeah, I still got it, I still didn't feel good, and I was vaccinated. So what's the point? The point is as I just told you, overall population, you're still less likely to get it. And in terms of the actual effects for the elderly, those are the ones that we should care the most about. And so I choose to look with compassion to a lot of these people who won't get it. I understand, exactly why and what they don't trust in more. And if you're young, and I've gotten many questions, so I want to make sure I address this here, that's why I personally think that you should get vaccinated from a population-wide level so that you can look to that. It's not just about yourself. I was always probably going to be fine. But, if there was a chance that we could make sure that somebody elderly, somebody immunocompromised or more couldn't, that's a different story.
Well, and also, when you did get it, you knew because you were vaccinated. You were very, very, very unlikely to end up in a hospital and, God forbid, dead. I mean, that's what it really protects against. So, yeah, there are breakthrough cases. You're case in point.
A lot.
Right? There are a good number of breakthrough cases. But as you said, if you get vaccinated, you're less likely to get a case, but you may still get a case. If you do, you're not going to end up in a hospital and you're not going to end up dead. That seems like a pretty good outcome. And you're less likely also to spread it to the community, and that's really important. This data on who is getting vaccinated is actually quite interesting, because if you look at they kind of break things down into these two groups. This one that's basically wait and see. And the wait and see group, a lot of them have waited and seen, and they're starting to get vaccinated. That's why you see this uptick, especially in places that are really hard hit right now. They're weighing the cost benefits. They're going, okay, I was a little nervous about the vaccination, but I know people who are getting sick. I know people who are getting hospitalized. I don't want that to be me or my kids or my parents or whoever it is. That wait and see group disproportionately are Black and brown. The definitely not group, disproportionately white. And by the numbers, very little that looks likely to persuade them. The top things that people said might lead them from the definitely not group to ultimately get a shot. One was free transportation, which I found kind of interesting. Another one was if the vaccination was required for them to be able to fly. And another one was if it was available from their personal physician. But we're only talking about roughly 10% of people in those groups who said that any of those things would be persuasive for them. So you have a group that just is hardcore. They've bought into some of the conspiracy theories, some of the people that they trust the most in the news space or in the pundit space or in the political space have been wildly irresponsible about what the information that and the lies that they're telling people. And unfortunately, you know, they've bought into it. And like you said, I have nothing but compassion for people in the way that they've been lied to and gaslit to the point that, you know, there's a large chunk of Americans who just aren't going to trust what the media tells them, aren't going to trust what the federal government tells them. And frankly, those institutions haven't really earned anyone's trust.
Yeah.
So that's the perspective from which I understand it. You've had a couple of really sad, relatively high profile deaths of conservatives who had been either, you know, anti-mask or sort of dabbled in anti-vax rhetoric. One was a Texas activist named Caleb Wallace, who was an anti-mask protest leader and has now passed away from coronavirus. Really sad situation here. And his wife told the newspaper that he began experiencing symptoms on July 26th, but refused to get tested or go to the hospital. Instead, he took high doses of vitamin C, zinc aspirin, and ivermectin. And of course, you know, don't do that without doctor's guidance.
Without a doctor, yeah.
Don't go and get the horse shit from the veterinarian. I mean, really, honestly, but what has really been disgusting, though, is a lot of the, like, triumphalism.
Yeah, they're cheerleading this.
About this.
I pulled two Guardian tear sheets to show you the way that they write it. It's terrible.
It really is disgusting to cheer for someone's death. And there's another one, a Tennessee radio host who'd criticized, he sort of like mocked vaccine efforts. Phil Valentine is 61 years old, and he now has also died of COVID-19. His family said, told listeners before he died that he wants his listeners to know that while he's never been an anti-vaxxer, he regrets not being more vehemently pro-vaccine. These are, you know, horrific, heartbreaking stories, leaving behind families, leaving behind children. This is nothing to celebrate or cheerlead. And to see the way that it has been celebrated in some corners, including in official media outlets, is really disturbing and ultimately disgusting. It also reminds me of that story that we covered about the doctor who went on MSNBC and was like, I don't think that people who are unvaccinated should even get medical care.
Yeah.
What?
I know.
What?
It's so crazy. And actually, personally, Phil had me on his radio show when I was like 22 years old, like when I had just started out. And he was a really nice guy. And, you know, he had a misguided view, in my opinion, but that doesn't mean you should cheerlead his death. And I think that that's really the gross part about this. And everything I see around all of this is that we would just be a little bit better off by like giving some people not even the benefit of the doubt necessarily, but just approaching it and being like, okay, what's going on here? Many people will tell you. Like I said, I was addressing the young. I had so many young people message me and like, see why I'm not getting vaxxed? I'm like, yeah, I get it. Like, look, you're probably going to be fine. But you got to think about, from a broader societal perspective, about the cost to you, which is getting sick, you know, slightly whenever you get it, maybe. And then if you do get a breakthrough case, you're not going to feel great. Okay, like that is baked in. Will feel better knowing that I'm protecting somebody who is older, right? Or at least tried to do so. I think that is probably worth it, especially when the entire thing is free. We've now had 1.5 billion people or something who've been vaccinated across the globe. Probably the greatest study that you could ever want, right? I think that stuff is really important. And so really what it is just talk to people. And if you don't want to get vaccinated, okay, but that doesn't mean we're not going to deny you health care. I think that's so insane. We tell people not to be fat, and a lot of people, what is it, 70-something% of the fat or whatever people in the country are fat? Are we going to deny, diabetes care? No, that's completely insane. And so,
or lung cancer,
or lung cancer from smoking,
or, liver issues because you drink
because
too
of
much.
Alcoholism, exactly. Yeah.
Please, it's insane.
The whole thing is just, we just need a little bit more compassion, for everybody else in the country.
That is very well said. Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.